Hello, and welcome to another episode of the Profit Minds podcast. I'm your host, Dr. Stephen Kirch, creator of the Profit Minds Growth System, a unique blend of profit growth, productivity acceleration, and building robust business process for scale. In every episode, I interview entrepreneurs and small business owners from around the world with a unique story to tell. You can find the show on YouTube, LinkedIn, Apple and Google Podcasts, Stitcher, Spotify, and more. Welcome, Kenneth.
Thanks, Steve. It is frustrating, confusing, even for me, sometimes.
Well, so what is it that is the most frustrating, do you think, for most people?
Well, I think that I know that the most frustrating thing is not just getting a plan. I mean, if you go and try and find a plan, there's a plethora of plans available, different deductibles, different copays, different coinsurance, but you can usually have someone help you through that process. So then you end up with a plan. What frustrates most people is once they have their plan, how to use it and what things are going to cost. It's not just the copay. There's things like coinsurance. What does the deductible apply to? What does it not apply to? Which hospitals are in my network? Which doctors are in my network? And that, for most people, is the most frustrating part of it. Not getting the plan, but using the plan.
Yeah, and I'm guessing that that's where having a savant help you is a place where, again, anybody can be an insurance agent and help you, sort of figure out, okay, well, I'll buy this one. It looks like that's the right thing for me. But navigating that, I agree. I remember shortly after I left Intel, my corporate thing, I fell on my bicycle and I had to be transported to a local hospital because I was, miles away from home. And they took me to the nearest trauma center because I was bleeding from my face and head. And, they didn't. And then I got this bill for like $4,000 for the ambulance because they took me to a place that they weren't authorized to take me or something. Anyway.
Well, it's interesting you bring it up as an example because just in, I think, January 1st of this year, the No Surprises Act was passed. And what the No Surprises Act says is that emergency room care anywhere must be treated as in-network care if it's actually an emergent cause for you to be there. So you wouldn't have gotten a $4,000 bill. You'd have gotten just whatever your regular copay or coinsurance would have been from your regular health plan. So both emergency room care, and also if you've ever gone to a doctor and you're getting a procedure and the doctor's in network, but then you end up with the kind of bill that you were just talking about. Oftentimes this was happening with anesthesiologists during things like colonoscopies. And what would happen would be your doctor would be in network, but the anesthesiologist would not be in network. And you would be required to pay that bill. And these would be thousands of dollars, $3,000, $4,000, $5,000. And they were getting, I hate to say it, but they were getting away with it until Congress just passed the No Surprises Act.
Wow. Well, it's good to know that things are still changing and evolving and improving. It seems like there's an awful lot of really high deductible plans today. Is there some way to reduce them?
Well, first of all, that is the movement. Deductibles used to be a common thing years ago. And Steve, you probably remember back when we had indemnity plans. You would pay, it was 80-20. You would pay 20%. The insurance company would pay 80. Once you met your deductible, it would be 100% coverage. And people were used to paying those kinds of things. And then when managed care came in, the deductibles kind of disappeared for a while. You're paying copays, you're paying coinsurance. Well, now we have something called consumerism. And what insurance companies are doing now is because of Obamacare's leveled healthcare, meaning gold, silver, bronze healthcare, because of those things, deductible levels are now reflecting how much you're paying for your premium. So the lower your premium is, the higher deductible is going to be. And most people don't want to pay the premiums for what would be considered the Cadillac plans or the Platinum and Gold plans. So they're stuck with deductibles that average about $5,000.
Mm.
Now, what do you do about it? There's a couple of things. One is you can get a deductible hedge. And what I mean by that is there are plans out there that you can pay $100 a month for, $90 a month for, and it will reduce your deductible to only $500 for any accident. Now, that's just for an accident, not for a sickness or illness, but still, 90% of all claims are for accidents. So it's a worthwhile investment for some people, especially if you have children. The other,
Yeah.
yeah, the other thing you can do is there's a new investment tool out there where you can run up if you work for a company, you can oftentimes participate in a flex spending or a health savings account within the company. And the company will match some of that amount. For the people that do not have those opportunities, there's now a tool available where an investment fund is matching in some shape or form the investment you make. So basically, it's roughly a dollar for dollar match. So after a couple of years, if you've put in $2,500, you'll have $5,000 you can use for medical expenses. If you put in
Wow.
5,000, you'll have 10,000 you can use for medical expenses. Now, you have to understand there's no cash value to this. It has to be used for medical expenses. But the good news for some people is not only does it cover LASIX, but it also covers cosmetic surgery, which is something that none of those plans used to ever cover before.
That's interesting. That sounds a lot like what I had, because I had, when I was working in corporate, I had a high deductible healthcare plan where I could put in money to an HSA, a health savings account, and it rolled over year to year.
Mm-hmm.
One of the challenges, we never did the flexible spending for healthcare, because the flex spending, you had to guess how much you were going to need, because if you
Use it or lose it.
didn't use it by the end of the year, then it went away, right? But with the health savings account, in fact, it went with me when I retired, when I left my corporate gig. I still have actually some of that money still hanging around.
Right. And the difference, though, is that's an investable fund, right? You can
Yes.
invest that fund. What
Mm-hmm.
I'm talking about is not, it isn't something that will grow as an investment. But if you're being matched almost dollar for dollar, the return you're getting on this is incredible.
Yeah. That sounds like a great deal.
Yeah.
So talk to me a little bit about Obamacare, or the Affordable Care Act. Is what's the coverage like there, and is it working?
It's incredible. I mean, I'm telling you, Obamacare, the Affordable Care Act, it provides incredible care. Number one is that there is it's called guaranteed issue. No matter what's wrong with you, you have to be able to get one of those Obamacare plans. So for people that have a chronic illness or have some heart conditions or cancer, it's great because you have to be allowed to get one of those plans. That's the upside. The downside for Obamacare is that it can be expensive. So unless you make an amount of money that allows you to get a subsidy, you can end up paying fairly high premiums. But subsidies have just been growing. Matter of fact, during COVID, with the what was the act that was during COVID? The American Cares Act.
Right.
The subsidies grew by almost 30%. And
Oh,
just this year, with the Inflation Reduction Act, they approved to have those subsidies last for another 3 years. So for people right now that are in the self-employed marketplace, you're getting a fairly sizable subsidy. Uh, yeah. So
yeah.
it's but the only other downside is sometimes, or not sometimes, usually the plans you would purchase will be restricted in coverage area. So It may cover you in your county. It may cover you in your state, but usually they do not provide coverage outside the state.
Unless, of course, it's for an emergency.
Only for
Right.
an
Which,
emergent reason.
again, as you covered earlier, you're right. The emergency now has to be covered no matter where,
Yeah,
no matter where it
exactly.
happens. Right.
Exactly.
Yeah, that, I mean, that we were, once I left corporate, we went to a Obamacare, Affordable Care Act, plan, and it was quite affordable.
Yeah. Yeah.
Particularly again, as an entrepreneur, you the subsidies during COVID went way up.
Right. But
And
if you get to be like us, Steve, meaning when we start aging, we will need more medical services. It's
it's
just
true.
part of being a human being. You don't people don't get healthier as they get older. So what we say in the insurance business is it's not the care you need today, it's the care you might need tomorrow. So there are plans out there that are national plans you can purchase that will allow you to go to the Mayo Clinic, that will allow you to go to the Cleveland Clinic, that will allow you to go to MD Anderson in Houston or Sloan Kettering in New York, where the best coverage in the world is provided. A lot of the state plans that you would buy in the marketplace do not have not only those hospitals, but even the top hospital maybe in your county. So those are things that people need to consider when they're looking at these plans.
But as you correctly point out, for somebody who has a pre-existing condition prior to the Affordable Care Act, they were just SOL, right?
Right,
There
but
was no way they could get insurance.
no, but and there are plans out there right now that are similar to that. Uh, that you have to qualify health wise. They have to be
Right.
underwritten. Now, the plus to those plans are that they are much less costly than the same coverage in the marketplace. So if you're making a really good income and you're not qualifying for a subsidy, you could be paying eight, nine, $1,000, $1,500, $2,000 a month for your health coverage. So there are plans out there if you can qualify for, will provide you national PPO coverage at half that. So rather than paying 1,000, you might be paying 500 and getting better coverage, but you have to qualify.
Wow, it's so complicated.
It really is. And that's not even, I mean, I had two things happen in the last 2 weeks. So I had one family come to me that he's got a great job. He works for some, I don't know, engineering kind of firm. I don't even know what they really do there, but he's only pays like $150 a month for his health coverage. He has a wife and
Okay.
2 kids. And last year they were paying $750 for their coverage. So, and oftentimes companies will do that. They will severely penalize the family to have them added to the coverage. That's also a fairly new thing that's being done. But this year they came in and they said to cover your wife and your kids, it's going to be $1,400. So that's why they talked to me. And I was able to
That's
find them a plan that now it's back to their $700 level. So with better benefits.
that's amazing to me, because I would never have thought to recommend somebody who works at a company to come to talk to you, because, hey, how can you possibly do better than a group plan at a company? But obviously, things have changed. I mean, I left the corporate world, no more than 6 years ago now,
Well,
and
no, but again, that's not normal, right? Those are outliers. But if you're an individual on one of those plans, it doesn't matter if it's an outlier or not.
right. If it's
It's
impacting you, yes.
if it's
If it,
you, and those are places. Oftentimes schools will do that type of thing. And
You mean to educators? That if the employee is an educator,
they
or
will
maybe
get the
both
cheap plan,
parents?
but the family won't. the family won't. And
Yeah,
that's,
interesting.
and it's also blue collar places that aren't heavily unionized.
Okay.
So
Yeah,
so
because
they
the
want
unions usually take care of the healthcare
right,
negotiations, that
right,
kind of thing.
right, exactly right. So if they're not heavily unionized, so they still want their employee there, but
Hmm.
it's expensive to pay for health insurance, especially some of these big companies are self-insured.
Right.
So every dollar being spent on coverage is out of their pocket. So if they can reduce those numbers, they want to do it. So
Right. That's Yeah. So one of the frustrating things we talked about was the trying to figure out what's in network and what's not in network. Um, once you have your plan, how to
well,
navigate all of that stuff,
yeah,
right?
yeah. The bigger issue is what's it going to cost me, right? That's what
Okay.
people really. I mean, again, whether you're in network or on a network, all people care about is what's it going to cost me, right? And that's the most frustrating part about health care is that it's the only thing that we buy without knowing what it's going to cost us. We're like, I need to get this thing done. Okay, I'm going in. Um, now all plans have a max out of pocket, so
Sure.
you're never going to spend more than whatever that max out of pocket is. And the highest amount for an individual right now in the United States is $8,700. So that's legislated. The most you're ever going to spend is $8,700. Now, hopefully, you're not going to have to do that, right? Hopefully, you're not going to end up with a major medical issue that's going to cost you that amount of money. We're talking about things that are going to cost $100, $200, $300, maybe $1,000, maybe $1,500. But you don't know what it's going to. I'm going to the hospital to get this procedure done. What's it going to cost me? I'm going to
Yeah.
the doctor's office to get this procedure done. What's it going to cost me? So two things have happened in the last 2 years. Last year, the final rule on hospitals transparency was passed, which required all hospitals to provide what they charged for different procedures. Now, as of now, only 15% of all hospitals have reported what those costs are. And you can go to a group called Turquoise Health. Turquoise Health is compiling that information. So you have partial information. And then the big thing happened this year. The final rule for insurance companies was passed in January of this year, in July of this year, July 1 of 2022, which means that starting now, all insurance companies need to start reporting what they're paying Dr. Kirch. So Blue Cross has to explain what they're paying Dr. Kirch for the physical exam, and so does United Healthcare what they're paying Dr. Kirch for a physical exam. So now you're going to know what your plan's paying,
Wow.
and that may change on how you choose your plan because Dr. Kirch isn't going to maybe, again, he's not going to be in some plans that aren't paying him very much, or he might leave a
Right.
plan. And the thing about that is that information though is being right now provided something called machine translated blah blah blah. I don't even know what it's called now. But the average person would not be able to understand these reports. So there are companies popping up now that are going to be taking that data and translating it into user friendly information. So
Is that like
that's happening.
using the patient codes or the diagnostic codes or any of
It's
that
not
kind of
even. It's
stuff?
not
Or
even. I don't even. It's not about CPT codes. No, it's not about any of that. It's again, I can only report what I read on it because I haven't seen one of those things yet.
yeah.
But supposedly, it's just data that's being spewed out that has not been consumerized, right? So the average person would have a
Yeah.
hard time figuring it out.
Well, it's pretty clear that this is a radical change for the healthcare industry,
Big
and
change.
it's not clear to me that they think it's in their interests to disclose I mean, if it were in their interest, they would have done it without legislation, right?
No, that's exactly right. They don't want no. It would be the same thing as you walking into a car lot and you saying, you know what, I'll take that car, and they'll say, okay, and then you drive it home, and the next week
Your bill.
you're paying $800 a month for this car, and you're like, wait a minute, I didn't
That's
want
not
a
what,
car that costs $800 a month.
right.
Car dealers would love that.
Yeah, somebody described picking healthcare, and this is a number of years ago, before the Affordable Care Act and all that kind of stuff, is going to a supermarket and picking out the food that you want without having any clue as to what it was going to cost.
Exactly.
Right.
Exactly.
And
yeah.
And I think there, for those of us who can afford it, the American healthcare system is wonderful.
Exactly.
And it provides great results.
The best in the world.
Yeah. But on average, I think we have to admit that, our system of healthcare is too expensive. We spend far more of our GDP than most of the rest of the developed world.
Exactly right.
And the results are not, on average, all that great.
It's because a couple of reasons. One is people don't know how to use the system. And one thing I say all the time is that people overpay for their health coverage. They get a bill from the hospital. They get the bill. Well, that bill should rightfully go to the insurance company. The insurance company provides its discount, right? It then pays what it's supposed to pay, and then you get something called an EOB, an explanation of benefits. And they always say this is not a bill. People don't understand that. Like, oh, this is not a bill. What do I really owe? I mean, people oftentimes will pay bills that they get from the hospital because then the hospital will harass them. And there was a big thing that happened it was in the Times last week, which to me was the most shocking. There's a lot of shocking things in healthcare, right? But this was a big shocking thing. Not-for-profit hospitals are supposed to provide free charity care if you are within 300% of the federal poverty level. And for a family of four, that poverty level is $85,000. Now, most people don't think that if they're making $85,000, they should be able to get free health coverage at the hospital, or free treatments, or free procedures. The hospitals are supposed to tell them. There was a consulting company that came into a hospital group, and I'm not going to name it, but it's all over the news, and they told them how to get these people to pay them for the procedures. Not to say to them, what do you think this is going to cost you? Instead, say to them, this is what this is going to cost you. We expect you to start paying XYZ. Now, this is a big, big, big scandal for this group, and also for the consulting company. But people oftentimes end up having to pay for things that they shouldn't pay for. And that's my commercial, right? That's the plug for me, which is if you have someone you can depend on that's an agent, whether it be me or someone else, you need to use them. This is not I sold you the policy, bye-bye. What this needs to be is an ongoing conversation, at least once during the year. How's it going with the plan? Are you happy with what you're getting? And, whenever you're doing something, it's worth having a conversation with your agent about it. If it's going to be something that's significant, not just going in for a physical exam or, a flu shot.
Yeah, which, by the way, are mostly covered.
Yeah, exactly. Those things, or a flu shot. Don't worry about those things. Yeah. But if you have to have a procedure of some sort, it's really worth having a conversation about, am I doing the best I can by my plan and by my pocketbook?
Yeah, that's great, Kenneth. I really appreciate that. And if somebody wants to talk with you about this this whole healthcare morass, if you will, the confusion of the healthcare system, what's the best way for them to get in touch with you?
Well, there's a lot of ways. I mean, I'm on Facebook, the Health Insurance Savant. I'm on LinkedIn, the Health Insurance Savant. I am all, again, my email is Kenneth Wright at the Health Insurance Savant. And I will give my phone number right now. I'm very comfortable giving out my phone number. If you want to call me directly or text me, you're more than welcome to do that. It is 917-710-2453. Again, that's 917-710-2453. And just, mention Profit Minds, and I'll know how you got my information, and I'll definitely reach out to you, because we're coming into open enrollment, and it is our crazy busy time. But if you come to me through Dr. Kirch's podcast, I'll treat you like I treat everybody else, which is really good.
Thank you. And by the way, I'm not that kind of a doctor.
Right, he's not that kind of a doctor, in case, he's a professor of productivity. So don't get you confused with anything else.
That's right. And we'll put all of that stuff in the show notes so that people will be able to connect with you directly by clicking a link. So
yeah.
And that concludes our show. Thanks to our guest, Kenneth Wright, the Health Insurance Savant. He always asks, why choose an agent when you can choose a savant? That's
right. Thanks, Steve. And that is true. I mean, the probably, and it's like this in a lot of businesses, whether you're buying a car or buying a suit, or or even working with Steve. If you choose to work with Steve and have him do some coaching for you, he doesn't just leave you out there laying. Once he's going to follow up and make sure this is working for you. You should expect the same from your health insurance agent, from your life insurance agent, anybody else out there.
So thanks again, Ken. You've been listening to the Profit Minds podcast. This is your host, Dr. Stephen Kirch. Please visit www.profitminds.net for other episodes or to contact me. Thank you for your positive feedback, comments, questions, and for sharing this show with others. Thanks for listening. Have a grateful day.